Hi, my name is Michael Guerrero, and today we will be talking about health disparities and inequities. Health disparities and inequities affect people all across the world, and it is especially present here in the US. You can even see some of the effects of these issues right here in our home of Long Beach. What is a health disparity or inequity? Well, according to healthypeople.gov, if a health outcome is seen to a greater or lesser extent between populations, there is disparity. An example of this is adult obesity rates for African Americans are higher than those for whites in nearly every state of the nation. 37% of men and nearly 50% of women are obese. Another example is close to a third of Hispanics lack a usual source of health care, and 46% of uninsured Hispanics who report having chronic health conditions lack regular care. Now, these are issues that can be a result of a great deal of factors, and that brings us to health equity. Now, health equity means that everyone has a fair and just opportunity to be healthier. This requires removing obstacles to health, such as poverty, discrimination, and their consequences, including powerlessness and lack of access to good jobs with fair pay, quality education and housing, safe environments, and health care. And now that you know what health equity is, we know that health inequity is the lack of. Why are health disparities and inequities an issue? So, why are they an issue? Well, health disparities are systematic, avoidable health differences according to factors such as race and ethnicity, skin color, religion, income, wealth, education, occupation, gender, sexual orientation, or other characteristics associated with discrimination or marginalization. These categories reflect social advantage or disadvantage when they determine an individual's or group's position in a social hierarchy. Health disparities and inequity may arise from intentional or unintentional discrimination or marginalization and, in any case, are likely to reinforce these social disadvantages and vulnerabilities. Simply put, health disparities and inequities are unfair, avoidable, and they affect everyone. So, what initiatives are being conducted to alleviate health disparities and inequities? A few initiatives that are being conducted include the Affordable Care Act, which aims to provide health care that is available and affordable for all. Another one is the Let's Move campaign. Michelle Obama launched the Let's Move initiative with the goal of solving the challenge of childhood obesity within a generation. The Let's Move initiative has 5 key pillars. 1. Creating a healthy start in life for our children, from pregnancy through early childhood. 2. Empowering parents and caregivers to make healthy choices for their families. 3. Serving healthier food in schools. 4. Ensuring access to healthy, affordable food. And 5. Increasing physical activity. Now, to bring this initiative to the local level, the Secretary, along with Michelle Obama, called on mayors and other local officials to be public leaders of the Let's Move Cities and Towns initiative. And lastly, we have the Boston Children's Hospital Asthma Initiative. In Boston, Black and Hispanic children are hospitalized with complications of asthma much more often than our white children. So, the Boston Children's Hospital Asthma Initiative program demonstrates that interventions by community health workers can significantly reduce hospitalizations in these populations. This initiative successfully resulted in an 80% reduction in the need for hospitalizations for children and 60% reduction in children needing any emergency department visits. Now, for every $1 that was spent on this program, there has been $1.73 in savings on health services. This goes to show that there are initiatives being conducted to battle health disparities and inequities, but we can always increase awareness. Well, here are my references, and that just about wraps it up. So I hope you guys enjoyed it, and I also hope that you were either able to learn something new or you were able to get a better grasp about health disparities, health inequities, and why they're such a big deal in society. If you did, I'm glad. Until next time, thanks for watching.